Good afternoon and welcome to the Multicultural Media Online Conference, hosted by the Multicultural Health Communication Service, the Ministry of Health, with the support of Multicultural New South Wales. Thank you for joining us. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your MC and host for this session. But we're really excited for today because we are talking about Multicultural Health Week, which started on Monday the 2nd and will end on the 8th. But we're talking about promoting healthy eating, celebrate culture through food with multicultural family lunchboxes. And this session, we have a very special guest, Adam Liaw, who's going to be joining us later on, and one of Australia's favorite chefs. And also we have with us two Lisas, Lisa Woodland, Director of the Multicultural Health Communication Service. Lisa, thank you for joining us.
Oh, thank you so much for having me.
Thank you. And also Lisa Yates, Principal Policy Analyst of the Center for Population Health in the Ministry of Health. How are you, Lisa?
Good, thanks.
Thank you. And we will have Adam joining as well. Adam, how are you? Adam, thank you so much for joining us online today. I think you are on mute. We'll just,
so sorry,
there you go.
And now I'm off.
No, it's okay. Thank you so much for joining us, Adam. But before we start, we'd like to acknowledge the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and also pay respects to Aboriginal colleagues and communities and Aboriginal colleagues who are joining us on this session today. We also pay respects to multicultural communities and refugee communities represented in this session. And we shall start this year. We have featuring healthy eating. Now, Multicultural Health Week is held since 2009, and it is our 15th year of Multicultural Health Week. And on the 15th year, we thought it would be fantastic to have Adam Liaw be our community champion to promote healthy eating. And so, Adam, thank you so much for joining us. This year, we partnered with you, and you have developed some fantastic resources for us that people are just talking about. Can you tell us a bit about your experience about this partnership and how how important it is to be involved in such an initiative?
I was really honored to thank Jess. I was really honored to be asked to partner with this because I think it is such an important thing to do. I come from a multicultural family as well, and I remember when we first came to Australia, it was really difficult to work out how to cook the things that we were used to eating, to have our culture fit with the way we were eating, when the conditions, I guess, for acquiring ingredients, the way the food was cooked, the layout of kitchens is different, the pots and pans are different. It's surprising how, I guess, difficult it can be to adapt the way that you cook to a new environment. This is kind of going the other way, but when I moved to Japan, I credit that move with kind of the time that I had to learn to cook, because I had to learn to cook in a completely different way, just because the supermarkets were different, the kitchens were different, the burners were different, the pots and pans were different. And it's the same for people coming here to Australia. We have to learn to cook a different way, and quite often things like health are the last thing that we think about because there are so many things that are changing. So especially now in a cost of living situation that is quite difficult, giving people the resources to be able to cook affordably, healthily, to make their packed lunches more than just packet ingredients that they're picking up from a supermarket is such an important thing. So I was really happy to be able to create these recipes, to be able to create the assets to show people how to, I guess, adapt their lunches to a healthier, more affordable and more multicultural approach was a really important thing this week for this Multicultural Health Week. So I was very proud and very pleased to be able to do it.
Oh, thank you, Adam. And those resources have been very useful, and the health workers will be able to use that. And you will see the links to Adam's resources and recipes there. But Adam, you also set a lunchbox challenge for Dr. Kerry Chant, the Chief Health Officer, and also Dr. Marianne Gale, who is the Director for Population and Community Health in Southeastern Sydney Local Health District. How was that experience? And it was really a really good, excellent way of talking about multicultural lunchboxes, Suzanne.
Yeah, setting the challenge for Dr. Chand and Dr. Tagao was a lot of fun, and I think more so than being just fun, it also illustrated how individuals' experiences are different. Here we have two very highly credentialed medical professionals who work in this area. Their lunches are completely different. So your healthy lunch does not have to be the same as the person who is next to you. There are many different ways to approach this particular issue, and it was. And I guess to personalize it as well. You know, I remember Dr. Chant brought in one of her teapots that she likes to have as a part of her lunch, and Dr. Gale brought in her lunch box and wrap that she had bought when she was on holidays. So I think sometimes in terms of public policy, it can very much feel like you're trying to cater to everyone, but it was a really great way to show how personal your lunch kind of not just can be, but also has to be, because you're the one eating it at the end. You know, I can create as many recipes as there are days in the week, but it's the person who is actually making the lunch and eating it who is the most important one.
Yes, and a picture can paint 1,000 words. So let's watch this video now, and you can see how that challenge, Adam's Lunchbox Challenge, went with Kerry and Marianne. Let's watch this video.
Hi, I'm Adam Liaw, and today I'm packing some quick, healthy and affordable multicultural lunchboxes with two very special guests, Dr. Kerry Chant and Dr. Marianne Gale from New South Wales Health. Marianne, what does a lunchbox look like for you most days?
Well, usually, Adam, what I try to do is pack myself a salad, maybe some protein like a boiled egg or some chicken, and usually some crackers, but nothing that looks as beautiful as this.
Kerry, why is it important to have a healthy lunch?
A healthy lunch really keeps your energy levels up and also stops you from snacking on unhealthy foods during the afternoon.
That's the really hard one, I think. So I have a Mediterranean vegetable frittata, a pea, potato and paneer wrap, some sushi sandwiches and some baked pita chips that you can choose from. I'm going to set you the task of packing a healthy lunchbox in less than 30 seconds. Now, it's got to be tasty and it's got to be healthy as well. So your time starts now. And that is the end of your time. Both of these lunchboxes look absolutely fantastic. Marianne, what have you chosen?
So, Adam, I've chosen here the paneer and potato wrap because it looks delicious and I love these flavours. Some nuts, some hummus, some veggie sticks because I always have to make a conscious effort to get enough veggies in the day, and I've got a pear.
Great way to get your 5 a day of fruit and vegetables. And Kerry, what have you chosen?
I've chosen this beautiful frittata, some berries and some vegetables, a bit of pita bread, also gone for some cheese and also some fruit cup.
The fruit cup is a really great choice because whether it's canned or dried or frozen, all those types of fruits have the same nutrients as fresh, so you can get it any way you can. And of course, the best thing to have with either of these lunchboxes is water. No need for soft drinks or juices, and you can even freeze your water bottle to keep it cool throughout the day. Well, two amazing healthy lunchboxes. All of these recipes are on the website, so maybe give them a go and pack yourself some healthy, quick and affordable multicultural lunches. Happy lunching.
And that was really good. And we showed those videos during the launch and an event today, Adam and with Kerry and Marianne, and they were really pleased. And the people were really happy.
It really just
to
dawned
see
on
them.
me that, you know, the recipes that we created, I actually wasn't even trying to make vegetarian recipes, and 3 of the 4 were vegetarian, and one could easily be adapted to vegetarianism. But you know, I was very much geared towards just creating recipes that tasted good, and it just happened that they contained a lot of vegetables.
Yes, it was really exciting, and a lot of people are very inspired. Now, I wanted to ask you, Lisa Woodland, can you please tell us about Multicultural Health Week and just giving us what resources are available?
Well, as you know, Jets, we celebrate Multicultural Health Week in the first week of September each year. And this year, the theme is around celebrating culture through food with multicultural family lunchboxes. And we're really promoting those messages of healthy eating to culturally and linguistically diverse communities. And look, that's so very important. And, you know, Adam's told us a little bit about the challenges that families can face. But we also know that there's a disproportionate burden on multicultural communities when it comes to diseases like diabetes, cancers, and chronic health conditions. So it's really important that we spread these messages and that they really, you know, get out to community. We know that healthy eating can actually reduce the risk of these chronic illnesses. So this year we had the added benefit of working with Adam, and, you know, I've had the privilege of seeing Adam's videos many times now, and each time they bring a smile to my face and the faces of everybody around me. It's just amazing. They're so engaging. And Adam, we really appreciate the very positive influence that you've had and the conversations that you have sparked amongst you know, colleagues, families, and social networks. It's been fabulous. I do have to say my personal favorite is the sushi sandwich, and I'm definitely going to make that for lunch tomorrow. So I'm inspired, and I hope everybody else is as well. Yeah, so I really want to encourage everybody to really think about what they bring for lunch, because it's such an important part of our eating day, and really take, you know, some tips from Adam and his videos and his recipes.
And all of the resources, we have them in different languages, Lisa. That's really exciting because more than ever during Multicultural Health Week, this is the largest number of resources we've had in languages.
Yeah, so we have a whole suite of resources. And importantly, we co-design these resources. So we bring in health professionals, we bring in members of the community to really think about how we can create resources that are really evidence-based, that have factual information that's really important to deliver, but that we deliver it in a really positive and engaging way. This year, to promote healthy eating, we have a fact sheet, and we've been able to translate that into 39 languages as well as English. And this is so important because we know that there's such a rich linguistic diversity across New South Wales. So reaching as many communities as we can is so very important. And look, these are freely available. Health professionals and community members, community workers can go onto our website and download these resources for free and really share them with family and with community. So we have some posters, we have some social media tiles. They have QR codes, so it's so easy to go and find the resources, you know, in your language and share those with others.
And I think we also have a multicultural, picking up from that challenge that Adam has, we've also come up with another initiative for young people.
Yeah, look, we just know that the voices of young people are so important, and they're really influential as well in terms of their peers, their families, and their communities. So this year we're tapping into the you know, creativity of young people, and we're launching the Multicultural Family Lunchbox Challenge. So this is a partnership with Western Sydney Local Health District and the Prevention and Education Unit. We're really calling on high school students from across New South Wales to get creative, to develop short videos with their families, packing lunchboxes together, being creative, using vegetables, using leftovers. So that competition opened on Monday and it closes on the 30th of September. So tasty, healthy, interesting recipes, please send them in. We have a panel of judges or health professionals, young people, community members, and some great prizes for people as well.
Thank you, Lisa. Now, Lisa Yates, why is healthy eating so important? And how important is it to have this kind of Multicultural Health Week to promote multicultural lunchboxes?
Absolutely. So healthy eating is really important because it gives us all the nutrients that we need for our body to function properly. And it's not just physical well-being, but it's mental well-being as well. So eating a healthy diet gives us all the energy we need to live, work and play, and also helps you sleep better, makes you feel happier, helps you to focus at work and school. Multicultural Health Week and this theme about food is so important because food really does unite us. It brings us together. It gives us reason to celebrate. The function that we had today here at work was amazing. We had so many people come in and just enjoy eating and sharing food, right? So our messages this time around were really about wanting people to get more vegetables in their diet. And it doesn't matter if those vegetables are fresh, canned, dried, so long as you can getting something in which is affordable, which is accessible and easy. So it's really important. We want everyone to drink more water and to drink less soft drink. And we're really wanting to make sure everybody knows they've got to keep their lunchbox safe and cool. So those are our 3 key messages. As to why we want to focus on lunch, well, children get about 1/3 of their food intake at school, right? So it's so important for their growth and development to have really healthy food, in their day. And you don't have to change the lunchbox completely straight away. It's tweaking it. It's just making minor adjustments, and maybe just adding some cut up veggies with a dip is going to be a really smart change to make initially. For adults as well, we want to keep our own energy levels up. And as Kerry said in that video, we want to sort of not snack on unhealthy foods in the middle of the afternoon. But if you have a good lunch, you're also less likely to have a big dinner at night. So you're kind of spreading out your food during the day as well. So yeah, it's been a fantastic initiative.
Yes, and I wanted to ask Adam about this because we talked about frozen food and how important that is. And Adam, the videos that you have, and when you're saying it, just get a bottle of water, pita chips, better than a pack of chips. It was just really interesting because we've been hearing, oh yeah, I'm going to do that. I'm just going to bring water. It really is just simple messages, isn't it, Adam? But making them tasty, keeping them as tasty, because there's this misconception that healthy eating isn't as tasty. What do you say about that?
Firstly, I'll say I'm not a food snob, so I don't feel that things have to be difficult. Secondly, eating healthy, I guess it does have a really bad reputation. We think it just means eating salads all the time, but healthy food can be really delicious, and actually is really delicious, because when you think about it, naturally, our bodies want the things that are good for us. I would also say that I was really happy to hear Lisa Woodland say that there is a lot of focus on kids. These lunch boxes are for the whole family, not just for kids, but for young people. At school now, they learn an awful lot about nutrition. They learn an awful lot about their own health, far more than I think that we all used to back in the day when we were at school. And so they understand, I think, quite broadly what is healthy for them. And they also talk about food a lot. My children come home from school and lunchboxes are a big topic of conversation. And so it's actually a really positive thing for a family to make sure that those lunchboxes are healthy for kids. And while they might, and my children often do, complain about something being healthy, they also know that it's good for them. They know that it's something the parent is doing to care for them. I can guarantee you, if a kid is going to, and I know this from personal experience, this is not just the way I think about it, kids that go to school with a lot of unhealthy foods in their lunchbox are not aspirational. My children will come home and say, look, such and such has donuts and chips and everything in their lunchbox, and they're not jealous about that. They're really not. They are almost a little bit sad that that child does not have a healthy option to go to school. So I think it's a really, these aren't just lunchboxes for kids, but packing a healthy lunchbox for children is such an important thing, both for their own health, for their understanding, and also socially.
You have any questions for Adam, for Lisa Yates and Lisa Woodland, please put them in, because it's not every day we get Adam here online and some experts on healthy eating. But one of the things that we would like to advise as well, there are Get Healthy services or services available to help with just providing advice on healthy eating. Isn't that right, Lisa?
Absolutely. We have a program called, as it is, the Get Healthy service, which is a free online and phone coaching service where we've got health coaches who are available to help you through your health goals. They actually also have bilingual coaches, which is really helpful. Lots of different languages, Mandarin, Cantonese. So, there's lots of support available for anyone who really does want to make some differences to their health. Yeah. And in terms of our own recipe inspiration, Adam, we've been working on a suite of recipes as well, which it doesn't matter if you're on your journey to cooking, you're just starting, you're just learning your skills, or maybe you're an old hat and you've just time poor. We've been looking at really simple, easy, quick recipes with accessible and affordable ingredients. You don't need a lot of equipment, you don't need skills, but all of those are on our website. So the healthyliving.newsouthwales.gov.au website is a great place to find those recipes. And the one that is the most popular one that we've put onto social media at the moment is a budget-friendly Italian vegetable soup. Who knew that something as simple that has vegetables and tastes delicious would do so well? So it's really exciting to see that.
Well, that's exciting. A soup can be delicious.
Yes.
That's right. And Lisa, you are also a aside from being director of the Multicultural Health Communication Service, you're also director of the Equity and Prevention Service. And so one of that is priority populations. And how important is it to be able to deliver key messages to culturally and linguistically diverse communities about healthy eating and preventing cancer and chronic diseases?
Look, it's so very important, as you know, Jess. And I think that we really need to make sure that people who maybe find it a little bit tricky to eat in an affordable way or have access to information about how to do that, that we really redouble our efforts to make sure that that information, the services that we have are really accessible and generally reach the whole community. We really need to think about what people need, how they need it to be, given to them, and how we support them along that journey. Because we know, again, with priority populations, people who experience those health inequities around those chronic illnesses, we know they're the people that need this most. This is who we need to design our services and our information for. These are the people we want to support.
Thank you, Lisa. And going back to what Adam was saying today, and earlier, Adam, you said that having grown up being a migrant and priorities, health is not much of a priority. It's always about finding a job or finding a home to live in, the schools. And these messages that you're sharing is really, really inspiring. Adam, what do you say about that?
Well, as I said before, really happy to be contributing to the solution to these problems. I think when there are, and we would probably mostly know this from our own experience as well, when there are a lot of things on your mind, your health will deteriorate. And the list of issues that new families have, new migrants have, people who are adjusting to every aspect of their life being different, health is the first thing that people forget. And the ability to have these resources here in language to remove some of the hurdles and the barriers to entry for accessing this kind of assistance does so much, not just for an individual's health, but for their continued engagement with New South Wales Health, continued engagement of members of these communities with our health system is really, really important.
Thank you, Adam. And Lisa Yates, with the strategy of New South Wales Health, with the Centre of Population Health, what is moving forward? What are your plans to ensure that we continue to deliver the right messaging and healthy eating programs?
So we have the New South Wales government has the Healthy Eating Active Living strategy. It's a 10-year strategy that was launched in 2022. And it's a plan for us to do exactly what you said, Lisa, which was to reach our priority populations, to design programs with them, for them. And it's a mixture of course, healthy eating and active living. And one of the areas that I work in the food policy unit, so one of the areas that we're looking at is also a little bit around what can we do in the food security space and how can we create healthy food environments so that people can access the services they need, as Adam said, and feel comfortable about doing that and knowing where to go to find that. And if we can't do that, then what wraparound services can we provide? And so that could be, our healthy school canteen strategy. We have another healthy food in health facilities strategy so that when people come to hospital, they're surrounded by healthy food and drink choices. So yeah, there's a lot going on in that space. Yeah. And even bigger picture, you know, the Australian Dietary Guidelines are under review. And so that's going to be a massive change to all our key messaging when that comes available in a couple of years' time. So, and of course, we're very supportive of the Health Star rating system as a really good way for people to choose healthier options in the supermarket. So yeah, there's a lot of work going on.
Thank you, Lisa Yates. Now, Lisa, Woodland, with Celebrate Culture, you know, Multicultural Health Week being in its 15th year, I remember we started this in 2009, and there are so many topics, but celebration of cultures is really inspiring. It's beautiful. It's motivational. Everyone can share the culture, but the way of celebrating food is really so much different than the other messages, isn't it?
Look, I think we love to celebrate food across cultures, and we love to share food across cultures as well. And I think that's one thing that really, you know, shines in New South Wales, is that we have such a wonderful multicultural food environment. So look, that celebration of culture brings people together. Celebrating food, eating food together brings people together. And it really gives us an opportunity within that context to share these really important health messages. We can celebrate culture, we can eat together. And if we do that in a healthy way, then we get the immediate health benefits of, you know, the energy and concentration that we need to get through the day, but also those long-term health benefits. You know, I think that all communities are really concerned about their health and long-term well-being. And this is a way that we can really work together to support everyone in the community around those things in a positive and joyful way.
Yeah. And who else? Who else can help us do that by Adam Lau, right? Lisa Yates.
I was just going to say that I think also it's that bringing families back together again, and the food culture within your family, you know, passing down those recipes that your grandmother made for you. And we're kind of losing a little bit of that. And so I think it'd be great to even get together in the evenings and build your lunch, make your lunches ready for tomorrow, use your leftovers, as Adam has so beautifully shown us how, just to kind of celebrate your family again. Yeah.
So Adam, you have you were a lawyer and you now embrace food. I think we're so happy that you've done that, because we get to see all the recipes. But in terms of celebration culture, you have a mixture. You said that was important. Now, whatever you have, the way you eat and whatever your culture can be inspiration to what you prepare for your lunch boxes. Can you tell us more about that?
Absolutely. You know, I think most people would identify with being quite time poor when it comes to preparing food. You know, that we've built entire industries on that. The thing is, food is fundamentally important, you know, as Lisa Yates just said, to family life. My son, for Father's Day, my 5-year-old just gave me a cup that he painted, and he painted us having dinner on it, and the sky was red. And I said, why did you paint the sky red and not blue? He said, well, it's usually sunset when we sit down and have dinner. And it was just a really lovely thing to have from him. The reason that we eat together is not just fuel. It's not just, you know, to get us through to the next part. There is certainly that aspect of it, but there are so many ongoing effects, from family cohesion to being able to eat more healthily than if you were just ordering food or getting takeaway for lunch all the time. The idea of being able to prepare food for yourself, whether it's for dinner or transferring those leftovers over to your lunchbox, is such an important thing for every aspect of our health, not just in terms of the nutrients we happen to get from the vegetables we have. And I really do think it's important to show people that it's not just, you know, the master chef, the food type of things that are important. It's the everyday cooking that I'm as soon as this call finishes, I'm going to go into my kitchen and make dinner for my family, which will be turned into lunch for us tomorrow. So it's not just a matter of not having enough time. It is about what we prioritize, because no matter what you prioritize, you will have time for it. And if you're prioritizing work over food or work over your family life, then that is the way it would be. So I really not just want people to understand that food can be made quickly and affordably, but also to prioritize that as something in their lives.
We can't get what you're cooking today for your family, but you've shared some recipes. But I just wanted to say, Lisa, Woodland, do you have? We've run out of time, and it's been fantastic to have you all here. But Lisa, Woodland, would you have any last words for the multicultural media, the health workers, and the community watching?
What I would really ask people to do is to share this information. We do have it in 39 languages. There's so many opportunities, and it's the conversations that come from it that are so rich. So a simple resource, very positive, engaging messages, some fantastic recipes. Get talking about it, share it with everybody that you know. Have those conversations about, what you ate when you were young, what the flavors from your culture. Have those conversations and really, really sell that message of healthy eating in ways which is really tasty and affordable and joyful.
Thank you so much, Lisa Woodland. And Lisa Yates, any last words?
I'm going to say it because I keep going on about it. We don't eat enough vegetables, but what I love about Adam's recipes is he's showing us how to make vegetables taste better. And I think that's key to getting people to eat more vegetables, that it's okay to, slather on your salad dressings and cook with olive oil and add your herbs and spices, all that kind of stuff. It just makes them taste so delicious. So please, if everyone could just tomorrow, just add one extra serve of veggies in your day, I think they'll do you the world of good.
Thank you, Lisa Yates. And Adam, any last words for everyone watching us today?
I would just say that cooking is something that is a practical skill. So even if you think that these are recipes that you can't do, firstly, you absolutely can. They are so incredibly easy, but easy does not mean that they don't taste good. So they're great tasting recipes. I genuinely want people to not just go, oh, that's a good idea, and then leave it at that. I want people to actually get in the kitchen and cook these.
Thank you so much. And Adam, thank you for joining us for this session, but also thank you for joining us as a multicultural health ambassador, because it's been wonderful working with you. You've been such a professional, and also your i8 Studios, your team has been amazing. So we really appreciate your support. So thank you. And thank you, Lisa and Adam, for joining us today, and for you out there watching this segment. We're really appreciating all your support, and it's Multicultural Health Week. Celebrate culture through food with multicultural family lunch boxes. Go online on the Multicultural Health Communication Service website on the Multicultural Health Week web page. Find out all those resources from Adam for the multicultural lunch boxes. There are videos with Adam with 15-second videos as well on healthy tips. And that video, we have a 2-minute video that is available in English and subtitled into Arabic, simplified Chinese, traditional Chinese, as well as Vietnamese. And again, as Lisa said, 39 languages for the fact sheets. Celebrate culture through food. Happy Multicultural Health Week. We'll see you again in the next fortnight.